A very good afternoon to the honorable dignities, faculties, and participants of today's session. I am Afra Farin from 2nd BSc Psychology, and I am delighted to welcome our principal, Dr. S. Sridevi, who is a pillar of strength and consistent encouragement, guide, and motivation for teachers and students in all the activities. I welcome you, ma'am. Now I request our beloved principal, Dr. S. Sridevi, to felicitate the gathering.
Good afternoon. Thank you, Afra Farin, for inviting me over to speak. It's been a pleasure to address this conference on mental health. For women, taking care of their mind is something very important because her life is built on living for others. That is the concept. Therefore, I'm very happy that the Department of Psychology has arranged for this conference in which scholars have come across to discuss the various aspects of mother's mental health. So, if you take care of a family, to take care of a woman's mental health, especially if she's a mother, then we are building a very sound society. I wish the conference all the best. I wish the department the very best. I congratulate the students and the teachers for bringing forth a lot of scholars for this conference. Thank you.
Thank you, ma'am. I take this opportunity to introduce our esteemed guest speaker for today, Dr. Najia Atif, ma'am. Dr. Najia Atif, ma'am, the lead trainer of the World Health Organization WHO endorsed evidence-based thinking healthy program for perinatal depression. Dr. Najia has delivered training in several countries across the globe. Dr. Najia specializes in researches, development, and implementation of culturally appropriate psychosocial interventions for maternal depression in South Asian women. She is based in Manchester, UK, and is actively involved in the grassroots work in Pakistan. With over 25 years of clinical experience counseling South Asian women of all ages, she has a deep understanding of their psychosocial stresses. She has also excelled in the field of consultant psychologist, senior research fellow, Human Development Research Foundation, Pakistan, honorary senior lecturer, University of Liverpool, UK. Let's extend a heartfelt gratitude to Dr. Najia Atif ma'am for graciously spending her quality time from her busy schedule in recording her wisdom and sharing it with us. Let's dive into her message with curiosity and enthusiasm, knowing that we are about to gain invaluable insights into the fascinating session. I request the team to telecast the recorded video of ma'am.
Hello, everyone. My name is Najia Atif, and I am a consultant psychologist. I am affiliated with Human Development Research Foundation in Pakistan and University of Liverpool in UK. So today I am going to talk to you about perinatal depression and why it is a major public health problem. So let's start talking about it. Let's begin by talking what depression is. And we all know that depression is a medical condition. And how it affects us? It affects our feelings, it affects the way we think and how we act. Depression, which begins during pregnancy and extends into the postnatal period, is called perinatal depression. And in 80% of the cases, the depression, which starts at the postnatal period, has actually its origin during the prenatal period. So perinatal depression vary in severity. The mildest form is the maternity blues. It is relatively mild transient state. It stays for a week, 10 days to 12 days, and then it fades away. And 75% to 80% of the new moms, they have maternity blues. On the other extreme is the postpartum psychosis, which is very severe. But luckily it is rare. Only 1 to 2% of the population, they have postpartum psychosis. And this is where the mother, they needs help, they sometimes need to be hospitalized, and it needs to be taken very seriously. Between maternity blue and postpartum psychosis is perinatal depression. Around 10 to 25% of the mothers, they have perinatal depression. Let's talk about the risk factors. What are the risk factors which makes the mother prone to have perinatal depression? So I have divided these risk factors into 4 categories. The socio-economic and cultural factors, the interpersonal relationship factors, the adverse life events, and their poor medical history. One of the biggest risk factors is the lack of social support. When there is no one you can talk to about your problems. Another big factor is the financial difficulties. Then lack of empowerment, lack of education, lack of appropriate health facilities, which is also closely linked to the fear of childbirth. There is also gender preferences. And this is something which is quite deeply embedded within our cultures. There is a preference for a male offspring, and that causes a lot of pressure on mothers. And that is a risk factor for perinatal depression. Then also there are rapidly changing traditions, family structures and practices. There is a lot of movement. People from the rural areas are moving to the urban areas. Previously, the families, they used to live in an extended joint family system. Now there are more and more nuclear families. And these all changes, they increase a lot of pressure. Then interpersonal relationship, another big issue if there is a problem in it. Recently, a systematic review has been conducted which has identified the intimate partner violence in low and middle income countries, the biggest risk factor for perinatal depression. It could be physical abuse, emotional abuse, sexual abuse, but this is a major risk factor. Then, poor marital relationship, poor interpersonal relationship with the in-laws, husband's extramarital affairs. These are all the relationship problems which makes the woman prone to have perinatal depression. Then there could be adverse life events. If it's unplanned or unwanted pregnancy, it is a big risk factor. If husband is being made redundant, there is a financial problems linked to that. Bereavements in the family, separations, divorce, even political unrest, crisis, floods, tsunamis, earthquakes, all these things, they are major factors. Then different traumas, then pandemics. Recently, we have experienced COVID. And because of that, the prevalence of perinatal depression has increased. Then your own medical history, it has a strong impact. If you have a previous history of depression, that can make you more prone of perinatal depression. If there are complications in previous pregnancies, if how many number of pregnancies you have, the number of times you have given birth. So all these factors are the risk factors. And it is very important to understand the risk factors, because if you are working with the population which has these risk factors, it means that the prevalence of perinatal depression is going to be high. So just think about it. You all are students. You all must be aware of what is happening in your community. How many of these risk factors are prevalent? And therefore, the prevalence of perinatal depression is much higher in lower and middle income countries. So globally, it is around 12%, which means that 2 women out of 10 experience perinatal depression. In high income countries, it is between 4 to 13%. And in lower middle income countries, the average is 25%. But in some countries, it is as high as 30%, 35%, even 40%. So this is a very high prevalence, which means that 4 women out of 10 or 1 woman out of 4 is experiencing perinatal depression. So this is the map which has been created by WHO. And if you see, India is in this yellow, where the prevalence is between 20 to 30%, which means that this is an important issue and something needs to be done about it. And therefore, it is called a major public health issue because the prevalence is very high. And the impact which the perinatal depression has not only on the mother, but on their babies. And there is a lot of cost involved in it. For example, in UK, the annual cost to address perinatal mental health issues is 8.1 billion pounds. So just imagine India, which has got 20 times more population than UK, And the risk factors are much higher. So just imagine that how much cost it would have been. So just by 8.1 times 20 is 160 billion, which I'm assuming is much higher than the whole of the health budget. So therefore, we need to address this problem timely. So talking about the impact, because I've told you that it is a public health concern because the prevalence is very high, the cost which is involved is very high, and because it impacts not only the mother but also the baby. So, the mother and the baby relationship starts developing right from the time when the mother conceives. The stronger that bond is, the more healthy the baby will grow inside mother's tummy. So, if a mother is experiencing depression, it can impact the maternal fetal quality of attachment. And there are a number of researches have been conducted, which has shown that the mother who is depressed has poor birth outcomes. The baby weighs lesser. Sometimes there is a preterm birth, and sometimes there could be a miscarriage. And after the baby is born, if a mother is depressed, she will not be able to provide adequate child health care. The quality of her interaction with the baby will be not as good as the mother who is not depressed. The child could be undernourished. There could be reduced breastfeeding, increased diarrhea rates, and the impact doesn't stop. It has a long-term developmental, emotional, cognitive, and behavioral impact. So considering how the mother who is perinatally depressed have a long-term impact on the baby again highlights that this problem should not be taken lightly. Something needs to be done about it. Now let's talk a bit about how it impacts the mother. Like I have told you, depression is something that impacts how we feel, how we think, and how we behave. So a mother who is depressed, she experiences all these feelings. She can be upset, she can be sad, she can be tearful, she can be irritable. And a person who is depressed, they can also be angry as well. They can be angry on themselves, they can be angry on people around them. They can feel a lot of guilt. They can feel tired, they don't have any motivation. They are fearful as well. They feel ashamed of why they are feeling like this, why they are having all these thoughts which are not helpful. And they can be suicidal as well. They have a lot of anxiety as well. So just imagine a mother who is pregnant or who has just given birth to a baby and is experiencing all these feelings. It's not an easy thing. How would that make this mother feel? And also, it impacts your thoughts. When somebody is depressed, they have these thinking patterns. So they tend to blame themselves. If anything goes wrong, they blame themselves for that. So if a child falls ill, they always think that, oh, the child has fallen in because I'm not a good mother. It's my fault that my baby is unwell. Then they have a gloomy view of the future. They predict that things are going to go bad. So they think that, oh, nothing can stop my child from getting diarrheas or from getting unwell. they have this unhealthy thinking pattern in which they mind read, but they always think that the people are thinking badly about them. So they think that, oh, people are talking behind their back. They are saying that, oh, I'm not a good mother. I shouldn't have a baby. I don't deserve this baby. So they tend to mind read, but that mind reading is all about these negative views of how others sees them. And if anything goes well, they don't give themselves the credit. They think, oh, it must be a fluke, or it's just by luck. So when you are not giving yourself credit for any good thing which is happening, how does that make you feel? That is going to make you feel upset. And they are always thinking in extremes. So if things cannot be perfect, there is no point trying. So a mother can start thinking that, no, I'm not educated. I'm never going to be a capable mother. I will never be able to do anything right. And they give up before trying because they strongly believe that they cannot do anything right. So they stop making an effort as well. So we all sometimes experience these unhealthy or unhelpful thoughts. Sometimes we do blame ourselves when things go wrong. Sometimes we don't give ourselves a credit. And sometimes we also give up before trying. But the difference is that when we experience these thoughts, we are able to overcome them. For example, maybe we will say, we will think that, oh no, because I have done few things in the past and they are very good as well. So I might not be able to have done this thing well, but this maybe I will try again and hopefully it will be better. So when we think like this, it can make us upset, but the period of upset is short. If that period will continue for more than 2 weeks, it means that yes, there is something wrong and some help needs to be given or taken. So this is the key point. Then, when you are feeling sad all the time, when you are thinking that you are not good enough, you can't do anything right, what happens? You stop making efforts. You just give up. So you stop making efforts to look after your health. You avoid meeting family and friends because you might be thinking that they don't mean well to you. They are talking behind your back. You stop engaging in pleasurable activities because you don't have that motivation. You don't have that energy. You don't have that will. And you don't enjoy those pleasurable activities which you used to do before. And a mother, pregnant mother who is depressed, she doesn't prepare for the baby's arrival because she doesn't develop that bond with the baby. She might be thinking that this baby is a burden. So you don't look forward to the baby's arrival. You don't prepare for the baby's arrival. And you struggle with your day-to-day responsibilities because you feel tired all the time. You have aches and pains. And you are not able to pay attention to your children's need. You can be angry. You can be frustrated. You can be irritated. And that can lead to being argumentative to others, being angry with others. So what happens when this mother, she is experiencing an unhealthy thoughts? So for example, if she thinks that she is a failure and this is making her feel sad, this is making her feel anxious, this is making her feel guilty. So if somebody is sad, anxious, guilty, worried all the time, what will they do? Will they look after themselves? No, they will stop making those efforts. So when you stop making any efforts to look after yourself, to look after your children, to fulfill your day-to-day responsibilities, what happens then? It will reinforce your thoughts that you are a failure, or you are not good enough, you are not a good mother, you are not a good wife. So when you think like this, it can make you feel even more worse. And when you feel worse, it can impact again your behavior. So in that way, a mother who is perennially depressed get caught in this vicious cycle of depression. So when you are caught in this vicious cycle of depression, it is not a happy state because it is going to impact you badly and it is going to impact your baby badly. It also impacts your relationship with people around you because if you are avoiding them, you are not sharing your problems with them, you become isolated, you become withdrawn. Of course, it can impact your relationship because they will not understand what is happening with this person. Why is this person behaving like this? Or why maybe you start arguing with them, you start arguing with the husband, and that can also distance your relationship and you lose that support. So when you lose that support, it becomes even more difficult for you to deal all with your thoughts and emotions and feelings. So these mothers can be helped. And what they need is someone to give them that empathy, that emotional support, the listening to them without judging them, and if possible, give them unconditional respect and love. And also, there are a number of therapies. One of them is cognitive behavior therapy. I am mentioning cognitive behavior therapy because there is a lot of evidence behind it. It is a talking therapy. And by talking therapy, we mean the treatment which we give to the mothers by talking to them, not giving them any medications. So cognitive means our thoughts, behavior is behavior. So cognitive behavior therapy, it works with the thoughts and with the behavior. And it is based on the concept that the thoughts, the feelings, and actions or behaviors, they are all interconnected, like we have discussed in our previous slide. And these negative patterns, they can trap a person in this vicious cycle of depression, which we have discussed in this slide. So what cognitive behavior therapy does it changes the way the person is thinking and it changes the way the person is behaving. So either by targeting the person's thoughts or by targeting the way the person is behaving helps the person to feel better. So this is a very, very important point that cognitive behavior therapy, it helps to change the person's thoughts and or their behavior. And once the thoughts are changed or their behavior is changed, that is going to change their feelings. Okay. So now I am going to talk a bit about the concept of task shifting. This is the area which is my focus of attention and which is very close to my heart. So in task shifting, what we do is that we deliver interventions through non-mental health specialists. Because there are many CBT-based psychosocial interventions, that are effective when they are delivered by non-mental health specialists. They are effective in prevention and treatment of perinatal depression, and they are helpful in fostering positive mental health among women in low and middle income countries. So, very recently, a systematic review has been conducted in 2023 by Prina. And in that systematic review, they have included 24 interventions, which are cognitive behavior therapy based psychosocial interventions. And they have found that they are effective. And the best thing is that they are effective even when they are delivered by the non-mental health specialists. So here in this illustrations, you can see that there is a mental health specialist who has delivered this intervention to maybe some experienced people and who have then in turn delivered this intervention to the non-mental health specialists who have gone in the community and they are delivering the mental health care. Like in India, I know there are Anganwadi workers which have been used for the delivery of mental health care, and they have been found effective. So what we need is maybe 1 or 2 mental health specialists who are then training number of non-mental health specialists to deliver this care. Why do we need this approach? Let's see the next slide. So in this slide, what you can see is that there is a lack of mental health specialists in low and middle income countries. So for example, if you see this lower middle income country, the number of psychiatrists is 1.05 for a population of 100,000. And there is 0.60 psychologists, even less than 1, for a population of 100,000 population. So how do you expect one psychiatrist to reach out to a population of 100,000 to help them, or even less than one psychologist to reach out to the population of 100,000? And we know that the prevalence is very high. So in lower and middle income countries, the prevalence is so high and the mental health specialists are so low that we are left with no choice other than to train non-mental health specialists. So we cannot expect them to be reaching out to such a large population. So what is currently happening is that there is a huge treatment gap. By treatment gap, we mean number of people who cannot access the treatment. The gap between the number of the people who are experiencing perinatal depression and the number of the people who can help them. This gap is huge. And the only way we can reduce this gap is by making the non-mental health specialist go and reach out to these people and help them. Because there is an evidence that psychosocial interventions, they can be delivered by non-mental health specialists. So we need to be making use of this evidence. So one of this intervention, which is an evidence psychosocial intervention for mothers experiencing pre- and postnatal depression, is Thinking Healthy program. In this intervention, we trained community health workers and lay volunteers. So once they are trained, they reached out to the mothers who were perinatally depressed in rural Pakistan, and then they delivered it. This intervention has also been delivered in India, in Goa, where they have trained Anganwadi workers. Because of the strong evidence of this intervention, this is now being adopted by World Health Organization and it is recommended as a first line management of depression in primary and secondary care settings during pregnancy and for breastfeeding mothers. So I am going to stop here because I have briefly told you about what perinatal depression is, what are the risk factors, how high is the prevalence, what is the impact of perinatal depression on the mother and on the baby. And all these factors, it highlights that it is a public health concern which needs to be addressed. And one way this could be addressed is through training non-mental health specialists to reach out to these mothers who are in need of help. They can reach out in communities, in primary healthcare centers, antenatal clinics, wherever these mothers are coming. They need to be identified and then they need to be provided with the help. So there are also a couple of questions which have been asked by the students. All those questions were very clever questions and I was very impressed. I've just picked a couple of questions. I'm conscious of the time. So I will quickly go through these questions before I will end this session. So one of the questions which was asked is that what specific challenges do mothers face in accessing mental health support? And are there any successful interventions or programs that have effectively addressed these challenges? So talking about these challenges is, the biggest is the lack of awareness of mental health problems. People are not aware. They misinterpret the symptoms. Sometimes they blame it on the evil eye. Sometimes they blame it on the black magic. And then what happens? That they take the mother who is depressed to the spiritual healers so that they can do their prayers, they can give them holy water, and they tries to cure them. So if the first step is to raise awareness of the mental health problem, and we should encourage the people to see mental health problems like they see the physical health problems. Like with the right interventions, the physical health problems can get better. Likewise, with the right intervention, mental health problems can also get better. And to overcome the stigma of mental health, which is huge. Very, very, very few people, they talk about mental health problems if there is anybody in their family or if they themselves are experiencing mental health problems. And also people are not aware of talking therapies. They are more aware of being treated by taking some medications, and the concept that somebody is going to come and talk to them and that's going to cure them, it's still very alien to the large majority of the population. So, and of course, things are getting better. People are becoming more and more aware of the mental health problems. People are becoming more and more aware of the talking therapies. And sometimes when I'm working with the clients, they do talk about black magic, evil eye. So the thing is that we cannot deny them, because if we will deny, they will stop listening to us. The idea is we first acknowledge their beliefs and then we say, okay, fine, this is what you are believing. But let's talk about, is it possible that there could be other reasons? If there could be other help available? So if they are going to a spiritual healer who is giving them some prayers to read or some holy water, and as long as the spiritual healer is not exploiting them, not taking too much money from them, it's all right. But we need to shift their focus on the other help which is available. Do they need to consult to the doctor? So we need to be encouraging them to think along these lines as well. That's going to be very helpful. And for example, when I was giving you the example of Thinking Healthy program, when the non-mental health specialists, the lay workers, when they take this intervention in the community, they say that this is the intervention for mother and baby's well-being. They don't highlight it as an intervention for depression. So you don't have to actually label people. Labeling is not that important. What is important is that you are working with the symptoms. So, what that mother is feeling, how we can address her feelings, how we can help her to engage in helpful behaviors, how we can challenge her thoughts. It's not the role of a community worker, or it's not a role of a non-mental health specialist to be labeling people. What their role is to work with the symptoms. So moving on to the next question is, are there specific research areas within maternal mental health where you see a need for further exploration or innovative approaches? Again, a very, very intelligent question. So far we have discussed that these psychosocial interventions, they can be delivered by non-mental health specialists, which is cost effective and which is in a way less stigmatizing as well, because community health workers or Anganwadi workers, they are already visiting the mother's home. Nobody is going to raise an eyebrow that why this woman is going in the mother's house. And while they are there, they also talk about the symptoms which the mother is experiencing and what can be helpful for her. But what happens is that when we deliver these interventions to the non-mental health specialist, one of the biggest challenges is the quality control. Because it could be possibility that there could be a slight drift from the intervention contents. And the training and supervision model, it needs to be very, very structured, very scheduled, very effective if we want to make sure that this model works. So one way we can overcome these challenges is with the use of technology. So again, I'm going to give you the example of Thinking Healthy program. Recently, we have developed an app. So currently, a trial is ongoing where we are testing how effective this app delivery of the intervention as compared to the standard model which is used. So this app, peers have been trained, which is local lay women. They have been trained how to use this app and the intervention which is in the app. So they take this app to the mothers who are in need of help. So the role of the peer is to provide empathy, to provide the support which the mother needs, to motivate the mother. And in that app, there are therapist avatars who are delivering the active ingredients of the intervention. So they are delivering the active ingredients, whereas the peer is providing that human touch. So the app and the peer, they act as a co-therapist in the delivery of this intervention. So this is a groundbreaking work because there are apps which are self-help, and the person who is experiencing some mental health problem, they are using those apps. But here, the innovation is that there is a peer who is taking that app and the peer is providing that human touch. And the app is delivering the active ingredients of the intervention. So when we say active ingredients, it means that the therapist within the app is discussing how the mother can change her thoughts, how she can change her behavior. So again, this is a cognitive behavior therapy model. So helping the mothers how they can identify their unhelpful thoughts, how they can change it, how they can identify their unhelpful behavior. And there are scenarios of women. So, by looking at those scenarios and how, by changing their thoughts and their feelings, the women in those scenarios have started making themselves feel better. Thank you. The third question is, as an individual interested in maternal mental health, how can I stay connected with your work and potentially explore opportunities for collaborations such as internships or research projects? I think one of the key things is to keep yourself updated with recent publications. First of all, to identify the area which you are interested in. And once you have identified that area, you need to keep yourself updated with the recent publications. And also identify where the gap lies. As a student, this is something very, very important. That the area you are interested in, what sort of studies are being done, what sort of results we are getting. Because if you are used to of reading the papers, there is always a mention that where more research needs to be done. So you can build on that. Again, there are always some funding opportunities going around. You must have got your supervisors, you need to be discussing with them. And then you start by doing small studies. This could be the pilot studies, feasibility studies, acceptability studies, but start from the small. Identify your areas you are interested in by reading the publications. Identify the gaps. Then look for the funding. Then discuss with your supervisors. Then start by taking small steps. So hopefully that's going to help you. So I'm going to finish my presentation here, and my apologies that I couldn't be there in person because of something which is unavoidable, but I hope you have enjoyed it, and thank you very much, and goodbye from me. Bye.
Thank you, ma'am, for educating us with beneficial wisdom and information. We have now come to the end of this conference. I would like to take a moment to thank our sponsor, Very Awakening Trust, which was founded by M. Halka River and M. Sivasubramanian in the year 2014 with a deep sense of belief and commitment to create equal access and opportunities for all human beings in aspects of life. The quality of the education ecosystem, opportunities for skill building, and exposure to access new opportunities varies greatly between urban and rural India. With 60% of 250 million children coming from rural India, the quality of the education ecosystem, access, and opportunities for skill building varies greatly between the urban and rural area. There is a need for systematic intervention and effective mentoring to bridge the above gap and transform the children and youth into future leaders, contributing in all sectors of our country. Accordingly, we have identified three focus areas where inequity prevails and crafted independent and unique programs to eliminate the inequity in those areas. The programs are as follows: Defense and Leadership Awakening Movement, eliminating inequity in access to leadership careers; Mental Health Awakening Movement, eliminating inequity in mental health literacy and treatment gap. The mission of the Mental Health Awakening Movement is to create awareness and eliminate the inequity in access to mental services amongst marginalized, less privileged people and the most vulnerable populations. WRI has impacted over 20,000 plus students through DLAM in 46 institutes and 700 students as a part of MHM. Thank you, Willie Awakening Trust. We are happy to collaborate with you. And Tunai platform has a YouTube, and the link has been posted in the YouTube comment section and also in the WhatsApp conference group. For more information, kindly click on the link and check for yourself. Thank you. And now we have arrived at the most awaited time of this conference. I request Dr. V. Subhashri, co-founder Tunai Trust, to announce the results of the conference.
Hello, everyone. My sincere gratitude and thanks to Dr. Alima to successfully complete this program. and looking forward to conduct many sessions like this. And it is one of the most important area that we need to work on, because what this is the need of the hour. That's what I'm thinking, and we'll be happy to work in more. Right. So thank you so much for the opportunity. And here are uh, the comments or the results are being out here, and it is not the one. Everyone did the best job over here, and maybe there might be some few reasons why this is being. It is just not about the topic which you choose. It is only about the best presenter. It is not about the best topic who picked it, right? So in the first session where Dr. V.D. Swaminathan chaired the session, where he has chosen two people as the best presenters. One is Miss Kavita and Miss Prezi. Another one is the Sriniti and Dharini Chitra. These two people got the best presenter award. On the second, group 2, Miss Afra and Miss Rukaya Fatima and Mrs. Lavanya. Am I spelling it correct? Rukaya Fatima, is that right?
Yes, ma'am.
Yeah, thank you. And in group 3, Mrs. Mita Behera. Mrs. Mita Behera in group 3 her representation is being selected as the best presenter. And in group 4, Asia Nadira Abdullah. So these are all the 4 people who has received the best presenter award for today's conference. Thank you so much. Tonight, heartfelt thanks to every one of the people, every one of the participants here.
Thank you, ma'am, and congratulations to all the best presenters and every presenters. I now request Mrs. Alima Zahra, Head Department of Psychology, CTTE College for Women, to read out the conference report.
A very good afternoon, everyone. It's my pleasure to read the conference report of International Conference on Prevalence and Importance of Maternal Mental Health Globally, organized by the Department of Psychology in collaboration with Internal Quality Assurance Cell of Chevalier T. Thomas Elizabeth College for Women and Tunai Trust, sponsored by Lions International Very Awakening Trust. The day started with a prayer song by Ms. Sharon on Second Psychology, followed by the welcome address by Mrs. Alima Zahra, Head Department of Psychology, CTT College for Women. The first keynote speaker was Mrs. Smita Rajan, co-founder Tunai Trust, a trauma-trained integrative therapist and a dance and movement therapist, who spoke on integrative approaches to maternal mental health. She significantly discussed the prevalence of perinatal and postpartum mental difficulties and also emphasized on psychosomatic factors and physicality which influences maternal well-being. Our second key speaker was Mrs. Aisha Chandni, founder of Mothers Club, Managing Trustee of the Hidayah Welfare Trust for Women, Action Committee Coordinator of Association of Lactation Professionals of India, highlighted the significance of paternal support in improving mother and infant life quality, promoting better lifestyle routines and sleep patterns, and assisting mothers with clubbed feet. Session 2 was taken by Ms. Swati Jagdish, psychologist, lactation consultant, and sexuality health educator, emphasized on the natural interventions that can be chosen in the course of lactation rather than medicated remedies, thereby ensuring better nutrition for the infant. Session 3 began with the principal's opening remarks, followed by the next guest speaker, Dr. Najia Atif, consultant psychologist, senior research fellow, World Health Organization, WHO, who emphasized on the Thinking Healthy program, perinatal depression and vicious cycle associated with the mother and infant, and how CBT can be a significant approach for maternal depression. At this conference, we had contributions coming from 16 colleges. We received 33 papers for paper presentation. Each paper proposal was evaluated by 4 chairpersons. And we are indeed grateful to the chairpersons, Dr. V.D. Swaminathan, retired professor, Department of Psychology, University of Madras, Mrs. Gayatri Shweta Kumari, Head Department of Psychology, MOP Vaishnav College for Women, Mrs. R. Margadam, Assistant Professor, Department of Applied Psychology and Behavioral Research, JBAS College for Women, and Dr. Srividya, Senior Consultant, Academics and Research, Tunai Trust. Papers were presented with the sub-themes, maternal distress and resilience, family and social support, for maternal mental health, coping with changes during pregnancy and postpartum, paternal mental health, optimism and family functioning, child's behavioral and emotional problems, and mother's mental health, maternal mental health and special education, evidence-based interventions for perinatal mental health, antenatal and postnatal depression, stigma, acts and advocacy of maternal mental health. The papers were judged on innovative research and sub-theme justification, and the best papers were selected based on these criteria in each session. We received 33 papers from 16 different organizations such as American College Madurai, Meenakshi Academy of Higher Education, Jain University Bangalore, St. Thomas College, Chinmaya Vishwa Vidyapeeth Cochin, Madras School of Social Work, Ratnam College of Arts and Science Coimbatore, PSG College of Arts and Science Coimbatore, SDNB Vaishnav College for Women, Sri Ramachandra Institute, Mother Teresa Women's University, Sri Kanyaka Parameshwari College, Stepping Stone Center, Bangalore, Krishna Jayanti College, Bangalore, Bhaktavachalam College for Women, and Savita Institute of Medical and Technical Science, Chennai. Dr. Subhashri, co-founder Thunai Trust, ended the valedictory program by announcing the results for the Best Paper Presenter Award. I want to conclude my report by saying that this international conference on prevalence and importance of maternal mental health globally has definitely increased awareness about the prevalence, challenges, and impact of maternal mental health in the community and globally, encouraged discussions on how mother's well-being impacts the well-being and development of the infant, understood evidence and research related to mother's maternal health in the perinatal period. Thank you all once again and have a great day.
Thank you, ma'am.
Thank you, everyone.
I request Ms. Fatima Shamrin, Assistant Professor, Department of Psychology, CTTE College for Women, to propose the vote of thanks.
Am I audible?
You're audible.
Okay. Greetings to all. It gives me immense pleasure and honor to deliver today's vote of thanks. I extend my heartfelt gratitude as we conclude this online international conference on prevalence and importance of maternal mental health globally, organized by the Department of Psychology and IQAC CTT College for Women in collaboration with Thunai Trust. First and foremost, I express my sincere gratitude to the God Almighty for showering His blessing upon us and making this event a grand success. I would like to extend my gratitude and sincere appreciation to our chairman, Honorable Justice Thirubi Gokildas, former judge of the Madras High Court, and to our managing trustee and correspondent, Thiru L. Palamale IAS retired, for providing this opportunity to organize this international conference. I thank our esteemed principal, Dr. Sridevi, and our vice principal, Dr. Quincy Asha Das, for being a constant support in all our endeavors. I would like to express our deepest appreciation to our distinguished speakers, Mrs. Smita Rajan, Ms. Aisha Chandni, Mrs. Swati Jagdish, and Dr. Najia Atif for sharing their expertise and insights with us. The presentations have been both informative and inspiring, enriching our knowledge and understanding of maternal mental health. I also extend my gratitude to our chairpersons for the technical session, Dr. V.D. Swaminathan, Mrs. Gayatri Shweta Kumari, Mrs. Marugadam, and Dr. Srividya for taking their valuable time and providing their rich insights. We are also immensely grateful for our sponsors, Willy Awakening Trust and Lions Club International for their generous support. And our sincere gratitude to Thunai Trust, Mrs. Smita Rajan and Mrs. Subhashri for being a pillar of support without which this conference would not have been possible. I extend my gratitude to Mrs. Alima Zahra, Head Department of Psychology, Mrs. Lavanya, and Mrs. Shirley for the tireless efforts in planning and executing this event seamlessly. And also, I'd like to thank all non-teaching staffs and CTTE media team for the technical support. Last but not the least, I want to thank all the participants for your active participation and engagement throughout the conference. And a special thanks to the conference secretary, Ms. Dharani Chitra, and research secretaries, Ms. Afra and Pauline, and all the students of the Department of Psychology for their support and cooperation in organizing this conference. In closing, let us carry forward the knowledge and connections gained here to continue making a positive impact in the field of maternal mental health. Thank you once again for being a part of this unforgettable experience.
Thank you, ma'am. Thank you everyone for participating and for your patient listening.